Assalamualaikum and good morning to one and all. Today we'll study about part 4 of drug used in special population with respect to the pregnant woman. So I'm Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to explain why use of drug in pregnant women is complicated and discuss harmful effects of drug in pregnant women and 4 stages of pregnancy. So in 4 different stages of the pregnancy, how this drug it is going to affect these different stages of the pregnancy and fetus who is growing under mother womb. Okay, so that we'll discuss in today's session. So let's start with the first learning outcome, that is why use of drug in pregnant women is complicated. So use of drug in pregnant women it is complicated by potential for harmful effect on the growing fetus, because the pregnant woman when she take the drug it is not only going into the maternal blood circulation but it also goes into the fetus blood circulation who is growing in the mother womb. So that drug it may produce harmful effect to the fetus. So since the fetus is also growing, so giving medicine through the pregnant woman it is very complicated process. So you need to not only consider the mother but also you need to consider the fetus who is growing in the mother womb. So this is one of the problem. Second important thing is that in case of pregnant women there is altered maternal physiology, means physiology of the mother. So we call it as the maternal physiology. So physiology of the mother who is pregnant it is altered. Why? Because during the pregnancy there are n number of different hormones which are released, and these hormones are generally not present when the woman is not pregnant. So during pregnancy only these hormones are released, different enzymes are released. Since there is release of these hormones which are related to pregnancy and release of different placental enzyme, these change the maternal physiology, and due to change in maternal physiology the same drug which produces the good effect in a non-pregnant woman it may produces the harmful effect in case of the pregnant woman. Likewise, the drug which produces the desired effect at particular dose may not produce desired effect at that particular dose, or the drug which produces pharmacological action, the expected pharmacological action at particular dose, that drug at same dose it may produce the adverse effect in case of pregnant woman. So this is the second parameter, there is altered maternal physiology. Third thing is that in case of pregnant women there is difficulty of research in the field because there is ethical problem. You cannot conduct clinical trials on the pregnant woman. So in all special population there is difficulty of research in the field. Since there is difficulty in the research, the established data which is related to drug safety and efficacy, it is very difficult to gather. So you are not getting the data. Since you do not have the proper data, then in such case if you are giving drug to the pregnant woman, then those drugs should be cautiously given and that woman should be kept under supervision, because you are giving some drug which were not earlier given on the pregnant woman, or there was no data of giving that medicine on the pregnant woman. So the difficulty of research in the field it also create major hurdle, or it made the drug therapy in pregnant women more complicated. So we have seen these are the 3 problems in case of the pregnant woman. Why in case of pregnancy or giving medicine it is the complicated thing, okay, and we need to consider many factors. So one of the problem we have seen was harmful effect on the fetus. So let's see how it may produce harmful effect on the fetus. Since there is limited experience on the uses of drug on the pregnant woman that we have seen in case of last parameter, that is we cannot conduct research on pregnant women. So obviously since research is not conducted, so we have limited experience on the uses of the drug on the pregnant woman. Since this is the case, all the drug should be assumed as potentially harmful. So if any new drug which was not earlier given to the pregnant woman you must assume that it is potentially harmful. It may produce adverse effect in a pregnant woman. Why? Because there is no enough experience is available for giving these medicines to the pregnant woman. So this is one of the major problem why the drug may produce potentially harmful effect on the fetus. Second thing is that the social drug like alcohol and cigarette smoking, these may produce the damaging effect on the fetus, and their use it should be discouraged. So especially in case of western countries like the USA, UK, Canada, in all these countries, the women they are generally alcoholic and they are also cigarette smokers. Since they take the alcohol and they also consume the cigarette, if such woman if she is pregnant, then this drug or this alcohol or cigarette smoking it going to produce damaging effect on the fetus, and due to that the use of these social drug it must be discouraged in the woman. Otherwise that child which is born from such woman it may born with some problem or some congenital disorders. So this is the second aspect which is related to the harmful effect on the fetus. Now let's see what are the different attributes of the drug that we must consider when we think about the effect of the drug from maternal blood circulation to fetus blood circulation. So what are those drugs having particular characteristics or particular attributes which can affect the fetus who is growing in the mother womb? Okay, so the most drug with molecular weight of less than 1000 can easily crosses the placenta, and there are many drugs which having molecular weight less than 1000 because drug they comes under micromolecules. Drug they are not generally macromolecules. So if drug having the nature of the protein, then the proteins are macromolecules, but most of the drug are the micromolecule having molecular weight less than 1000. What it means? It means these drug can easily crosses the placenta. So you can see this is the growing child or growing fetus in the mother womb, and this is a placenta or the point of connection between the child and the mother. Okay, and through the placenta this child will get the nutrients from maternal blood circulation. Now suppose if this is the maternal compartment or maternal blood circulation, right, and if the drug is present over here, then this drug can easily goes through the blood into the placenta, and through placenta this drug can produce certain level of effects in the fetus who is growing in the mother womb. So one of the characteristic it is the drug having molecular weight less than 1000. Let's see what are the other characteristics. So in such case, if drug having molecular weight less than 1000, then such drug can crosses the placenta by the process of passive diffusion. What do you mean by passive diffusion? Passive diffusion means drug is moving from high concentration towards the lower concentration. Now obviously when mother take the medicine, then in such case the maternal circulation, the blood of the mother, it contain more concentration of the drug, and there is no drug at initial glance or at initial condition in the placenta. Then in such case you can see the concentration gradients it is created, where high concentration it is present in the mother blood circulation and low concentration it is present in case of the fetal blood circulation. And due to this concentration gradient, drug will move from high concentration to the lower concentration, that is from maternal blood circulation into the fetal blood circulation if it having molecular weight of less than 1000. And this process of movement of drug from high concentration towards lower concentration, it is called as passive diffusion. So drug generally move from maternal circulation to the fetal circulation or to placental circulation through the process of passive diffusion. Now let's see what are other characteristics of the drug on which the passage of the drug from maternal to fetal circulation it's depend. Okay, so the rate of diffusion of the drug it is depend on especially the concentration of the free drug. So if concentration of free drug, if it is more, if it is not bound to the plasma protein like albumin, if that is the case, and that case the drug movement from maternal to fetal blood circulation will be more. So the concentration of the drug is one of the factor. Second factor is the drug must be present in unionized form, and this is universal principle that if any drug, if it has to cross any lipidic membrane, and the placenta it is made of the lipid, okay, so it is generally the lipidic membrane. So if it has to cross from the maternal compartment from to the placenta, then drug has to be present in unionized form. If it is present in unionized form, then only it will absorb from mother blood circulation into the fetal blood circulation. And that is the same principle it is there even in case of the GI tract. If the drug, if it is present in unionized form, then only it is absorbed from GIT into a blood circulation. So the same principle it is applied over here. So the drug must be present in unionized form, and if it is present in unionized form, then it is matter of concern because it may cross the placental barrier and it may affect the fetus. So this is the second parameter, that is unionized form of the drug. Third parameter, it is a lipid solubility. So if drug it is highly lipidic in nature, then in such case this drug can easily crosses the placenta and it may affect the growing fetus in the mother womb, because placenta it is made up of the lipid, it is also lipidic in nature, and if drug is also lipidic, then this drug can easily crosses the placenta. Okay, so I hope you understood different attributes of the drug which can cross the placenta and can affect the fetus who is growing in the mother womb. In addition to this, the placental function is also modified by change in a blood flow, because the placenta or the growing fetus, it is completely depend upon the mother nutrients, isn't it? So if the blood flow, if it is reduced to the placenta or to the fetus, now suppose this is the placenta, that is point of connection between the mother and the child, okay, so and this is where the child is reside in the mother womb, okay, so and the nutrients getting from the outside through the placenta. So through the placenta this child getting the nutrients, and nutrients coming from the blood, maternal blood circulation. Now suppose if if this maternal blood flow, if it is affected by the drug, so this change in a blood flow, it may also affect the placental function. Now let's see what can happen if the blood flow, if it is affected to the fetus. So the drug which reduces the placental blood flow, obviously it will also reduce the supply of nutrients to the fetus, because fetus getting nutrients only from the mother blood circulation. So if you are giving the drug to the mother which can reduces the placental blood flow, then those drug can reduce the birth weight of the baby. So you can see if mother is taking the medicine which can reduces the blood flow to the placenta, then newborn baby which is born to such mother will take birth with low body weight because it reduces the birth weight, isn't it? So this problem may happen. So the example of the drug which may reduces the birth weight of newborn baby, it is the atenolol. So n number of drugs are there which can reduce the blood flow to the placenta. I have just quoted one example. So atenolol, it is the beta receptor antagonist. It is generally given to maintain the normal blood pressure. Okay, so this could be the problem, or this could be one of the issue when the drug it is given to the mother who is pregnant. Now let's see what happened to the blood-brain barrier. So we have seen about the blood flow. Now we'll see about the blood-brain barrier. So do remember that the blood-brain barrier, it is not developed until second half of the pregnancy. So what do you mean by second half? Generally there are total 9 months in the pregnancy. So 4.5 months. So this is the first half. and after that there is second half. Okay, so do remember this blood-brain barrier, it is not completely developed in case of fetus until second half of pregnancy. So what it means, it clearly indicates that there is more susceptibility of central nervous system of the fetus to the drug, because the barrier between the brain and the outside environment, it is blood brain barrier. Now if that is not developed, it means anything which goes to the placental circulation can reach to the fetus brain, and it may produce harmful effect on the central nervous system of the fetus. So susceptibility of the CNS, it is more, and due to that drug may produce a certain level of effect also on central nervous system. So this could be one of the problem. In addition to that, there are multiple placental enzymes which are released in case of the fetus or in case of pregnant women, and this placental enzyme has ability to contribute to the drug metabolism. Now if you imagine, if drug, if it is given to the pregnant woman, if that can be metabolized by the placental enzyme, then the same dose of the drug, it is not sufficient to produce pharmacological effect, because the metabolism of the drug, it is enhanced by the placental enzyme. So to produce desired effect, you need to increase dose of such drug. So it's depend upon what medicine you are giving, what are its attributes, where it may produce the harmful effect. Sometimes it produces the harmful effect and sometimes it produces the under effect. So the placental enzyme, an increase in metabolism of the drug, it especially produces the under effect. So I am writing under effect as the U effect. So U effect, it is the under effect. Okay. So I hope you understood these points which are related to the medicament given to the mother and how it is going to affect the fetus who is growing in the mother womb. So I have done with my first part of today's session. Let's move on to the second part of the session, that is effect of drug on 4 stages of the pregnancy. So let's first we'll see what are 4 stages. So the 4 stages of pregnancy, the first stage, it is a fertilization. Second stage, it is the organogenesis or embryonic stage. Third stage, it is the phytogenesis, and fourth stage, it is the delivery of the baby. Let's see about the first stage, that is the fertilization. So the fertilization, it is the stage where the male gametes and female gametes, they can come together, and here the fusion is happen. So this process, it is called as fertilization. So there is no enough data or evidences available on the fertilization, the effect of drug on the fertilization, especially on the pregnant woman. But yes, if there are evidences which are available on the animal study, and evidences of animal study, it show that the fetus before 17 days of the gestation, it can causes the abortion if the drug, if it is given to that pregnant woman. So if drug, if it is affected to the fetus, and if that drug, if it is given before 17 days of the gestation, it may causes the abortion. So this is based on animal data. In addition to that, if pregnancy, if it is continued, now suppose if there is no abortion, in that case, in case pregnancy, if it is continued, then the fetus, it's remain unharmed. So there are both the cases where if drug is given before 17 days, there was the effect was seen was the abortion, but in the few animals, the pregnancy was continued and fetus remains unharmed. So this is the effect on the first stage of the pregnancy, that is fertilization. Okay, so this is most favorite question of the examiner. Write a short note on the effect of the drug on 4th stage of the pregnancy. So we have done with first stage. Second stage, it is organogenesis and embryogenesis. So name itself indicate that in the organogenesis and embryogenesis, it is the process where the organs are developed. Okay, so the fetus, it is differentiated to form a major organ. So the major organ, like the hands, the limbs, the brain, everything, it is developing during this process. So fetus, it is differentiated to form major organ. Since major organs are formed at this stage, the teratogen, we have seen what are the teratogenic drug, the drug which produce harmful effect in growing fetus, it is called as teratogenic drug. So teratogen or any drug which is teratogenic in nature, it can causes abnormalities in development of embryo if they are given during the phase of organogenesis. This is the second stage of the pregnancy. So we have seen the good example in case of thalidomide. It is the well-known drug. We have seen it has produces the phocomelia, which were the congenital birth defect in case of the child was seen when thalidomide was given during the second stage of the pregnancy. In addition to this, the special precaution is needed between the 4th and 7th week of the pregnancy. Why? Because during this 4th and 7th week of pregnancy means after 1 month and before completion of second month of the pregnancy, you need to take special precaution, because during this stage the organs are developing. Now if you give any drug which is teratogenic in nature, it may produce the phocomelia or the organ deformities in case of the newborn baby. So we have seen the good example of was the teratogenic drug. There are n number of drugs which are teratogenic in nature, like thalidomide, it is well known. Cytotoxic drug like the anti-cancer drug. Alcohol, it is teratogenic, so it should not be consumed during this stage. Warfarin, which is anticoagulants, it is also teratogenic, and lithium, it is also teratogenic. So these are only few examples for your information, but there are many drugs which are teratogenic in nature. So all those drugs which are teratogenic should not be given between 4th and 7th week of the pregnancy. So you must remember this very important point. So no need to remember the drug, and you can just remember for exam purpose 1 or 2 drugs, but in the database the list of teratogenic drugs are available. So if pregnant women coming to your shop to take the medicine, you must be cautious and see that the drug prescribed by the physician is not a teratogenic drug. Okay, so this is the effect on the second phase of the pregnancy. Let's see what is the effect on the third phase of the pregnancy. So the third phase of pregnancy, it is called as the phytogenesis. Now what happens in case of phytogenesis? Here the fetus undergo further development and maturation. So organs are developed in the second stage, that is organogenesis or embryogenesis, but development and full maturation, it is occurred in the third stage, that is called as the phytogenesis. So fetus undergo development and the maturation, and if the drug it is given, then drug produces significant adverse effect on the fetal growth and development, because in this stage the development and maturation is happening. Now if you are giving those drugs which may affect the fetus, they are going to make that child undergrow, or their growth become less, and also the maturation or development of organ is not complete, isn't it? So this could be the problem if drug it is given in the third stage of the pregnancy. So third stage of pregnancy, it is start from after 7th week of the pregnancy. Okay, so the ACE inhibitors and angiotensin receptor antagonists, it was seen that they produces the fetal and neonatal renal dysfunction. So if you are giving ACE inhibitor at third stage of pregnancy, it produces the fetal and neonatal renal dysfunction. So that is something which is very serious. It affects the kidney. So that should not happen. Okay. So this is one of the effect, and we'll see few more example of effect of drug at the third stage, that is the phytogenesis. So like tetracycline, it is the antibiotics. So if you give this antibiotic at the third stage during the phytogenesis, it is observed that it inhibits the growth of the fetal bones, and it also stains the teeth. So if the teeth, obviously to the newborn baby there is no teeth, but whenever teeth come, those teeth are stained if the tetracycline is given during the phytogenesis stage of the pregnancy. Likewise, the warfarin, it is an anticoagulant drug. If it is given to the mother during phytogenesis stage, then it may produce fetal intracerebral bleeding. So there is the bleeding in the fetal when the fetus it is present in the mother womb, and that could be dangerous to that fetus. Okay, so the warfarin can produce the fetal intracerebral bleeding. Aminoglycoside, a very important class of the antibiotics, if it is given to the mother during the phytogenesis stage, then it is observed that it produces the fetal 8 nerve damage. So these are the different problems it may produce if the drug, if it is given to the mother at a phytogenesis stage. So when you are giving the drug to the mother during phytogenesis stage, you must take proper precaution and see that you are giving only those drugs which are not going to produce bad effect on the growing fetus in the mother womb. So we have seen third stage, that is the phytogenesis stage. Fourth stage, it is the last stage, that is the delivery of the baby. So during this stage, if it is given during late in a pregnancy or just before delivery or during the delivery, then it may also produce a certain level of effect. Like pethidine analgesic are given generally when mothers suffer from intolerable pain, because we know that during the delivery maybe there is very severe pain mothers suffered from. So if such intolerable pain is there, or maybe that the mother is taking the pethidine even for another reason to reduce the pain, in that case the pethidine analgesic if it is given, then in those drugs it may produces the fetal apnea. Okay, so this could be the problem. So but this fetal apnea can be easily reversed by the morphine antagonist, or those drugs are called as narcotic antagonists like the naloxone. So if you give the naloxone, it can easily reverse the effect of the pethidine, that is the fetal apnea. So this is one of the example. Let's see few more example like warfarin. If it is given in the late in pregnancy or during delivery of the baby, it may having ability to produce the hemostatic defect as well as the fetal cerebral hemorrhage during the delivery. So during the delivery, the newborn baby, the bone or the fetus which is present in the mother womb suffer from hemostatic defect, the defect in the blood, and the fetal cerebral hemorrhage, that is the loss of the blood, especially in the cerebrum. Okay. Likewise, generally you give anesthetic agent during the cesarean. If there is no normal delivery of the baby, then if mother is undergoing the surgery or the cesarean, then also you are giving anesthetic agent. So these anesthetic agent given to the mother during the delivery of the baby or during the cesarean, it may produce the depression of the neurological, respiratory and muscular function. So it will depress all these different function of the brain, respiratory systems and the muscles, right? So you must be very cautious while giving drug at different stage of pregnancy. So to summarize, we have seen total 4 stages of pregnancy. The first stage that we have studied, that is the fertilization. So fertilization, there is no good amount of data available on the pregnant woman, but yes, animal study data is available. So up to 17 days drug may produce bad effect, and if it is given it may produce the abortion. But if pregnancy is continued, then there is no effect it is produced on the fetus. Second stage was we have studied was embryogenesis. So between the especially 4 to 7 week of the pregnancy, so this is the embryogenesis stage or organogenesis. It is very dangerous. So at this stage, teratogenic drug should not be given. So all teratogenic drug, if it is given during this stage, it is going to produce very bad effect, right? Third stage we have studied where we have seen the phytogenesis, where organs are matured and developed. If drugs are given at this stage, it will affect the maturation and development of the organ, and organs are not properly matured, right? And we have seen the few example like warfarin. It produces the cerebral hemorrhage in case of the children. Likewise, aminoglycoside produces 8 cranial nerve damage and so on, right? And last one, if you have seen, the drug also produce effect during the late in pregnancy or during delivery of the baby. So I have done with my today's session. I have gathered all this information from the James M. Reuters, the Lion D. Lewis, these textbooks of clinical pharmacology and therapeutics, the 5th edition. So I must thank the author of this textbook for providing the wonderful information on the special population and drug used in a pregnancy. So thanks for watching my session. For more such learning, subscribe to my channel, and if you like my session, then do remember to give me a thumbs up.